My topic now in 10 minutes is to talk about the cardiac arrest on the pitch from theory to trackside. And of course, it only will be a short glimpse for you. I mean, as a professional team doctor for 20 years at international and national level, I mean, the worst fear I have is sudden cardiac arrest, of course, and the same for you, of course. So that's the trackside nightmare. Regarding theory, I mean, we know what to do. We know that the survival rate will depend on the time to defibrillation. And although you have some Swedish letters up there, you can understand that I'll see if I have that here. You can see that the survival rate goes down, and this is the minutes to defibrillation. At the same time, we also know that early CPR will adjust and have an effect on this. So if a CPR is conducted early, you will have a higher survival rate at each of these minutes. So we know what to do. We know we have to apply defibrillation early, and we know with the best results out of hospital survival for a month. We also know that we should apply a CPR as early as possible. So that's not the problem, really. The problem is to convey this, as the title of this talk implies, to the practice. And we've tried to do that in different ways. And this is coming from the ESC, try to say that what you need really is a framework around this to achieve this goal. You have to have a medical director for the event, the arena, and you also have to list all the things you need to achieve this goal in terms of personnel, medical equipment, what kind of communication do you need, treatment facilities, transportation, documentation and communication with emergency medical system and so on. So this is all listed and should be like a list you should follow when you organize an event. More specifically, this medical action plan should be mandatory for each arena, and it should be individualized. They must be coordinated and integrated with the local emergency medical system, because somebody else has to take over and at some point, and you also have to have a person who is responsible for this. That's a key in this. When we asked about medical action plan at different levels, many arenas said they had an action plan, but it was not written down, and I wonder where that plan was then. So we have the person responsible, and a written plan it's very important. It's also been now mandated by UEFA and FIFA, for example, that the kind of equipment you will need at pitch side to achieve this goal, and you have to have a defibrillator, and you have to have emergency personnel, you have to ambulance being ready, and so on. So this is now mandated possibly as a result of these recommendations. So when it works in the ideal situation, it could be illustrated by this example from Australia, that you could achieve a very high percentage of survival. And if you have a number here, like 28 cardiac arrests at the arena, 24 of the 28 left the arena alive, and 26 of the 28 were defibrillated within 5 minutes. And we also know that an ambulance takes around 10-11 minutes to reach most of the arenas. So if we can use such a system where it's coordinated, where it's tailor-made, when you have a support strategy to deliver this CPR and defibrillation, that is the theory, that then you can achieve good results. But we have a lot of obstacles and problems to achieve this at the practical level. So this is this kind of arenas what we face. And when we talk to the arenas and ask them in questionnaires, do you have defibrillators, and how long does the transportation from the ambulance to your arena take, and so on, and do you provide training and personnel and so on, we were a bit disappointed because the quality and were very different among the top arenas in Europe, and even some of the arenas having over 10 minutes to an ambulance with no ambulance present did not have an AED or defibrillator present at the arena. So there was a lot of inequality, and that's also part of the recommendations. That's why they were created. So we have great challenges, and this has been listed by Luis Serratosa before, that you need to navigate large crowds, nuclear landmarks, frequent barriers to access, limit possibility to use motorized transport. You can have multiple casualties and potentially dangerous environments, and also you can have patients who refuse the necessary medical care. And all these are very, practical obstacles to achieve this goal in real practice. For example, this could be what you're facing to reach a patient with a chest pain or sudden cardiac arrest in the stands, or even this. So it's tough to achieve these goals, and you should be training in the national environment. But other potential challenges could be it's stressful for everybody involved, environmental conditions, lack of sufficient resources, VIP medical care, and could be difficult to reach the hospital in time, communication challenges, and also possibly acts of terrorism and other barriers. And I can give an example of that. That's according to the last World Cup in women's football in 2015. The authorities told us when there is a sudden cardiac arrest in women's football, before you do anything, you should reach the team from the bench. They should walk out onto the pitch and form a ring around the player, and then you can take the shirt off. And when I told my players this, they thought I was crazy. So this is what happens now, and you put an unnecessary barrier to saving lives by doing these kind of things. Unfortunately, this recommendation was not part of the Olympic last time. So we face different environments. We must expect this is also a pitch, right, or a similar pitch. We play ice hockey in our country, and the death could occur, a sudden cardiac arrest could occur on the ice, of course. And it could also occur in a ski race, where this is a ski race of 50,000 people competing at a 100-kilometer race, 90-kilometer race. And of course, in long endurance races as well, you have to apply this whenever the competition is, and even more extreme environments. Of course, you have to provide the same security for the athletes. So really the key then is to achieve this, to put the theory that we have to provide simple. The theory is simple. You have to provide CPR within 1 minute, and you have to provide defibrillation within 3 to 5 minutes, whenever the competition and environment and type of competition you have. And therefore, as we outline now together with Louise and Efrain Kramer in a new chapter in our EC Sports Cardiology book, that it's not about the medical action plan, one size fits all plan. It's the medical action plan must fit all sizes. So we have to adjust the plan so that it fits the specific type of competition we have, the arena we have, or if it's a running track we have. So we have to fit that. An example of that is what's been provided by the paper from Motika that says that you calculate here how many defibrillators do we need in this arena, this specific arena. And this calculation is all individual for each arena, and then you can calculate how many defibrillators do I need. Then you have to do these calculations and thinking for what you need in terms of personnel and communication and so on. Because we should have marked and trained personnel. You should also have equipped emergency rooms, and they should be clearly marked. And of course, you should. We advocate that you should advertise the medical action plan in the match program, but you should also advocate, and we should advertise it to the opponent team, so they don't have to travel to your country 1 or 2 weeks or 1 month before, which was usual before. So they should give all this information should be given about the hospital, the medical action plan, and so on for each site. And of course, training is necessary. You could train laypersons to achieve a much greater success in terms of CPR, of course, and also defibrillation, if you do this. And it's been shown by this study, for example. So maybe this is ideal. This is also from Real Madrid. This is a slide given to me by Luis. And I would say that they do a lot of things. Was before actually the medical action plan was advocated, so they were doing these things beforehand. But we have to apply the theory into practice, and it involves a lot of steps, but the key is to individualize the medical action plan according to the type of arena, type of condition you have, and that's the key, I think.